came to office. We could not fulfill it earlier. Probably wouldn't have reached to be part of the industrial notice. But because we could not achieve it, we didn't have a board in place. As you are aware, the board was sworn in less than a month ago. So we have worked very hard. So I want to take this opportunity also to compliment the new public service board for banning the midnight oil. When I left on a Friday, I told the board we will have to do this on Tuesday. So they have been working day and night. And I want also to commend the union officials because they have worked with us. We have not been working in isolation.
For the union makes us strong. Solidarity forever. Solidarity forever. For the union makes us strong.
But maybe you sit you guys out front.
Okay, thank you.
Asanteni sana.
Thank you.
Thank you so much. Nice meeting you also.
For that song, you know.
Kwa ajili ya msemaji wa serikali na wajumbe wake wote ambao
We have agreed, and today we have the bone of contention or promotion of job groups. People who are job group J and G have now moved to N. Isn't it? That's yeah. No. From M to N. Yeah. And then we have those who are 96 doctors who are moved from job group N to P and P to Q. Doctors have worked for 10 years, 6 years. They have not moved from one group to the other. So we have agreed to them. This has been a long journey since I came to office. We could not fulfill it earlier. Probably wouldn't have reached to be part of the industrial notice. But because we could not achieve it, we didn't have a board in place. As you are aware, the board was sworn in less than a month ago. So we have worked very hard. So I want to take this opportunity also to compliment the new public service board for banning the midnight oil. When I left on a Friday, I told the board we will have to do this on Tuesday. So they have been working day and night. And I want also to commend the union officials because they have worked with us. We have not been working in isolation. for coming this far. We have agreed on our working formula in future, also how we'll engage more to make sure that our health department runs smoothly. If there are any issues, we should be able to solve them in-house. We don't have to always join everybody else. By the time the national office gives a notice, they should be told by the coast branch that Kilifi wako sawa. Na hii nataka ijulikane kwamba haikuwa demand ya madaktari. Kitu moja tu nimegundua leo ni kwamba madaktari wetu hawakuwa wamewekwa katika mkataba wa ile kitu ambayo nilianzisha. Ilikuwa hapo lakini ilikuwa haiendelei. Lakini sasa tumeweka pesa. Ile kitu mwingine nimemwambia madaktari leo, kila mfanyaji kazi wa kaunti ya Kilifi anaruhusiwa kupata mortgage either ya nyumba ama ya gari. Kwa hivyo nataka kuambia madaktari hata nyinyi pia, as long as you work for this county, you will be eligible for both mortgage ya gari na ya nyumba. And I've told the county secretary to advise the same to the mortgage team management that everybody who works for this county is eligible. Nafikiri watu wa mortgage waona madaktari mna pesa mingi hata waambii. The only thing they didn't tell you, but you are part of us, so everybody is allowed to have that. So that's the only extra thing which they had not asked, but I asked them as a governor. Nyinyi kweli mnachukuanga mkopo, sema hata hatujui kama huko. So we have instructed that they can also, as long as you work for this county, you'll be able to assess that. That's...
Ningependa kuwashukuru timu yote ya governor kuanzia Public Service Board ambao wamechangia pakubwa sana huu mgomo hujafanyika. Timu yetu ya KMPDU Coast Branch na KMPDU as a entity. Wale watu wamechangia siku kama hii ikafanyika na ile tunasema kwa kimombo avert a crisis that would have been tragic. Unajua daktari wa Kigoma watu wanakufa. Sasa kwa hayo kuna mingi ambayo tumejadiliana, yote yako katika hii tunaita return to work formula. Kwa madaktari wetu ningependa kuwasihi, tumeelewana, mambo yetu tumeelewana hapa ni mambo ambaye itakuwa muhimu kwenu, it's of importance, na ni mambo ambaye ningependa kusema tumejadiliana, hakuna pali kuna daktari ameumia. Angalau wale ambao hata kama hawajashughulikiwa sahi, venye His Excellency the Governor amesema wakati wao utafika. Na yote tumejadili na iko katika hii return to work formula. We brought up the issue of insurance cover, something that is supposed to be looked at, the issue of doctor shortages. We know there are a number of hospitals, actually all the hospitals in Kilifi, that are having shortages of doctors for all the cadres that are covered under KMPDU, the medical practitioners, the pharmacist and the dentist. We asked our able governor and his team to look into it. It was captured in our return to work formula. We also asked, and we came to find out there's issues of our mortgages and car loans that are also enshrined in our collective bargaining agreement 2017-2021. And it's something that we are happy that the county has now taken up. It's going to be part of what we share back to our members. Tell them now, money has been set aside. Let us go for these car loans and mortgages. Doctors will no longer suffer in these counties of coast. We've had a fruitful engagement, but let them understand, wasione paka amenyeshewa wakafikiria, simba amenyeshewa wakafikiria ni paka. We'll come and we'll come with a big bang. We are coming to sort issues in those counties. They have to make health a priority. We are not going to take a back step. We will ensure that the doctors get their due rights. In fact, yesterday when we were just coming, we managed to see an ambulance from Tana River rushing to bring their doctors just here to Kilifi. So it shows you are overburdening this system that is already trying to do something. Do something in your own house. We have less than 70 doctors for a catchment population that is numbering to almost 600,000 to around 600 to even a million, because sometimes you get people even from Somalia sometimes accessing the island. So we want Just like security is going to be given a priority in the areas of Lamu, whereby our doctors are serving there despite the security concerns, we want a surety. People cannot be serving at very junior job groups. We cannot be having officers in the county government, for example, of Lamu, sabotaging the governor by refusing to allow doctors to willingly be part of a union. That one we will not allow. That is one line we will not take lightly. We are going to put those governors to task. Let it be a warning to them.
Leo ni siku ya furaha, tutasema kwa upande mwingine, kwa madaktari wetu wa Kilifi County ambao kwamba currently tumepata promotion ya watu 101 na bado ambao kwamba waliobakia kuna wengine watapata promotion zao tukiendelea tukisonga mbele. Sasa hivi promotion 101 zishachapishwa, ziko tayari. Alhamisi kila mtu atachukua barua yake, na huku akingojea Januari ikianza kureflect kwenye payslip, na areas zao kila mtu ni miezi 6 na kila mtu atapata areas zao. Kwa hilo kwa sasa tulipofika tunasema mgomo umesitishwa. Hatuna tena mgomo. Kwa sasa kila kitu kitarudi kama kawaida. Watu watakula Christmas zao na barua zao vizuri, na tunasema governor asanti kwa hii kazi uliyoifanya, na watu wako wote, wasimamizi wako walioamua kuchoma kibahalulu cha mafuta ya taa usiku mpaka haya mambo yakakoa. Na kwa hivyo tunasema asante sana. Malindi sub county imefanya 180 cesarean section ambazo kwamba zote zimetoka county ya Lamu na county ya Tana River. Sasa tumetoa warning, ilani kwa magavana hawa wawili, tena kwa hususan, tena nitawataja kwa majina yao. La kwanza ni Isa Timami na wa pili ambao kwamba ni wa Tana River. Wote wawili tunawapatia ilani. La kwanza, tengenezeni hospitali in terms of human resource. 1. 2, promotion of all doctors. County ya Tana River iko na madaktari 26 wanaohudumia county mzima. Hilo ni changamoto kubwa kwa upande wa Tana River, na ni kitu ambacho kwamba they need to do it this time before tufike January tarehe 15. Ikifika tarehe 15 asitulaumu, maana kama hivi Kilifi tulivyofanya kule itakuwa ni mbaya zaidi. Na Lamu asione kwa amesahaulika, tuko njiani. Lamu ina tabia ambayo kwamba haitaki kufanya promotion. Daktari anaifanyia specialist ako job group P, na wanapeana contract za upuzi ambao kwamba zinasema 2 years contract kisha job group P. Sisi tumesema hiyo imekataliwa, na tunawaambia wale wote wanaoenda kuapply Lamu, don't apply unless they change their terms and condition. Tunawaomba madaktari wa kule waone sikwati tunaanza kuwachocha. Hii ni haki yao na tutapigania haki zao. Kazi zetu sisi ni kupigania haki za madaktari, sio kitu kingine.
The union continues championing the rights of doctors, and would like to put to task Tana River County and Lamu County. We would like to say without fear of contradiction that the working conditions of our doctors are deplorable, and they should understand that they signed the collective bargaining agreement, which was between the KMPDU and themselves. And we'd like to tell them that we are coming. You are next. We are done with Kilifi. You will be next. You cannot have doctors working in hospital without a simple machine like the full hemogram. No X-ray machine is working in the whole of Tana River County. How are these accidents being, and it's a highway, how are these accidents being treated? What are these doctors using? The county government wants doctors to practice witchcraft, and we as a union shall not and will not accept that.